Good morning. So I was thrilled when I learned that Mike Tryon had been invited to speak to this group today. And I was even more pleased when I found out that I get to introduce him. So as you just heard from Kurt, Mike is a state representative in the Illinois General Assembly. He was first elected in 2004. He represents the 66th district, which is up in the McHenry County area, a little bit northwest and toward Wisconsin from here. He also is the assistant Republican leader in the Illinois House, and he serves on the following committees: Energy, Business Growth and Incentives, Environment, and Mass Transit. But I've had the chance to work with Mike on several occasions over the past few years in Springfield, which is our capital and where I live. So here in Illinois, we have a body called the Illinois Diabetes Legislative Policy Committee. And this is a group of, I guess you describe it as major stakeholders in diabetes. Many of us are healthcare providers, but we're also joined by the advocacy reps from the various industry partners that we all work with. And I'm happy to say that one of our main advocacy reps is with us this morning from Merck, Marty Matthews over there. And I don't know if John got here yet. John Valenti was here yesterday from Santa Fe. But it's a forum where we have conference calls approximately every 1 to 2 months. And the minutes are always disseminated. So for those of us that are busy seeing patients and couldn't get on the call, we still, get to participate by following the minutes and such. And this group has held annual meetings, usually during National Diabetes Month, and it'll be like a half-day afternoon thing where the legislators are all invited, and any of us join in, and there are presentations and whatnot, and Mike and I have both been speakers of that. So it's a great body, and we were involved in reviewing the Diabetes Action Plan for Illinois when it was formed a few years ago, and you all got to see a little bit of that yesterday. But in addition, Mike has really been instrumental in forming the Illinois Diabetes Caucus for legislators. So we have a body within Illinois, just like they have a Diabetes Caucus at the federal level. And so this allows them to talk to one another about diabetes issues and look at policies, see if changes need to be made. They've done activities in their local districts to bring diabetes awareness, with their own constituents and just invite people to come in and talk about diabetes. So I think you can tell from this that Mike is absolutely an amazing champion for diabetes education and diabetes educators. And I know he has a lot more to tell you about his own story. So please help me welcome Mike Tryon.
Well, thank you, and thank you for inviting me. I can tell you, talking about diabetes at 8 o'clock on a Saturday morning and finding people that are actually excited about it is kind of exciting for me. How is that? But I will tell you that what we're going to do today is we're going to talk a little bit about my journey with diabetes and the efforts that we've made in Illinois by putting stakeholders and policymakers together, some of the things that we've been able to accomplish. Talk a little bit about how you work with a group like ours and a group of legislators to debate public policy wherever you may be in your pursuits as a professional, and hopefully I will make this interesting. I promised Kurt that, at least when I started. But I started my political career 28 years ago as being elected to the county board in a county just about 50 miles from here. And I served 10 years as a member, and then 6 years as chairman, and then 12 years in the General Assembly in the House of Representatives. And the one thing that I like to say that I have found out in all of these political positions that I've served in is the power isn't in the position of state representative or state senator or governor or speaker of the House. The power's in the process. And people that can engage the process and make it work can get some things done. And that process doesn't just include the people who are elected. That process includes advocates, lobbyists, people who have interests in seeing public policy advance. We had a case in Illinois where we had to change the law because a kid with diabetes who couldn't live in a group home and self-administer his diabetes drugs. And so we changed that law. And he was able to enter into a group home. So we're finding that as the disease grows, policy needs to change because we have an antiquated view of diabetes and how it should be treated and how we should advocate for it as well. So let's look at my journey. Being elected in 2004 required me to be out campaigning and walking a lot and doing all these healthy activities. And I went to Springfield and I was immediately thrust into this lifestyle that isn't family friendly and it isn't healthy. We're going to talk a little bit about that. So every capital that I've been in, and I've been into several capitals, has generally a restaurant in it. Ours was called, when I got there, the Capitol Bistro. It made it sound like it was going to be French or something really good, right? Well, the Capitol Bistro, and Kurt can testify to this, had one specialty. They took good food and made it really bad and unhealthy, right? So this is actual bowl of chili that we were to eat. And then you can see that little morsel on the grill. They actually got mad when we took a picture of this. That's the Capitol breakfast sandwich that you can buy along with the lunch buffet. Kurt's been there several times. I think Ann's probably been thrusted down into the Capitol Bistro to try to find something healthy to eat. So combine that with long working hours. Go there sometimes I've been on the House floor from 9 in the morning till 3 the next morning. When the debate sometimes went on long. The first time we debated the death penalty, it was 2.5 days, things like that. There's no breaks. There's no, I got to stop and eat, it's nonstop and very stressful. But then you get done in the evening, and then there's receptions. So you have you go at the food again, and it's neither healthy and not particularly healthy. You can get some healthy things, but there's a lot of it, and you overeat. So basically, I went in very healthy, and at the end of my very first session, 5 months into being a state rep, I did not feel good. I went home. I was tired. I was exhausted. I called my doctor, and she did complete blood work and called me and said, "What were you eating in Springfield?" And I said, "Steak." And she said, "Every night?" And I said, "Pretty much so." And as you can see by the blood work there, I wasn't doing too good. And that's when she told me that I had to really get my diet and everything under control. So I did what most people do, I think, who have a doctor who tells you have to get your diet under control, give you a little meter, and they give you a little 2-page pamphlet on how to eat and send you out the door, right? And so I did pretty good. I stopped eating out every night. I tested my blood sugar all the time, and I put myself on the internet. Great resources, bad place to learn, if you don't know what you're learning. And before I knew it, I was on an Atkins diet. And I'm not trying to be on an Atkins diet, but I thought carbs were the enemy. And again, after about 6 months, wasn't feeling too good. Cholesterol still going up, having problems. So I had to ask my doctor to prescribe a diabetes educator. And I knew from just being in the General Assembly that we required insurance companies to pay for it. That seems to me to be the first line of defense, right? And what actually happened is I did try testing myself in diet, and one time I ate 3 tacos. And I was at an expo, and the hospital in my community had a little booth across the way from me, and I didn't have my meter there, and it was about maybe not quite 2 hours after I ate, my blood sugar was almost 400. So I went into my doctor, and she said, "Well, we're going to do a glucose tolerance test," and we did it. And she said she was going to have to medicate me. And that was a very sobering day for me as a person, you know, and she wrote me a prescription. I went home kind of depressed, walked in the house, my wife's making dinner. I sat down, I turned on the TV, watched the news. First thing on the TV, haven't even eaten dinner, is, have you or any of your family members taken the diabetes drug Avandia? You may be eligible for this class action lawsuit. And I look at my prescription thinking, I think that's what she gave me. And that's what she gave me, okay? That was day one with diabetes. But I will tell you this, I probably got the best control with Avandia I had. It was a fabulous drug, but after a couple of years, you know, she took me off of it, and rest is history. But that led me to realizing that after about 3 years into this, that, you know, I'm pretty well educated, and this is a daily battle. I mean, if you don't treat diabetes like a hobby, it's hard to get your arms around it. I mean, it's constant. It's a data disease. You have to make decisions based off you know, carbohydrates and when you eat and what your blood sugars are 2 hours later. I, for 2 years, was pretty religious about keeping a journal. I knew if I went out and I had egg whites and sliced tomatoes and bacon and one slice of rye toast, 2 hours later, this is what my blood sugar should be. And I got used to that. But I also found out that you know, I wanted to do something more, and I had this opportunity as a legislator to affect public policy. And I actually was I had got visited by a diabetes educator that was working for one of the pharmaceutical companies, a woman named Lynn Wentz. I don't know if you know, do you know Lynn was in here in Illinois? And we were talking about it, and I said, you know, I was working with my hospital on a D-Teens program to try to come up with a way to work with the school districts and the hospitals to maybe get some curriculum credit for somebody that had diabetes if they took diabetes education and stuff like that. And she said, you know, there's so much to do. If you could get a group of legislators together that could focus on this, and that kind of came in that maybe if we got a diabetes caucus together, which would be a group of legislators to focus on this would be good. And so we started finding out a little bit more about how diabetes affects Illinois. And this actually is data from 2011 when Illinois had 9.5% of its current population has diabetes, type 1, type 2. We have the highest incidence of diabetes in the nation of any group of people in the city of Chicago, in a neighborhood called Humboldt Park. It's Puerto Rican. It's over 35% of the population there has diabetes. The hospital there has the #1 amputations with non-injuries, #1 incidence per capita of kidney disease. All the comorbidity factors that go along with diabetes are seen right there in that community. CDC is actually doing a study there. It's funded a grant in Humboldt Park, and they started the Illinois Diabetes Center there, and are focusing. They have a door-to-door campaign educating people. They're working with restaurants to actually put on the menu diabetes-friendly dishes. As you can imagine, in the Latino diet, certainly a lot of fats and a lot of carbohydrates, and we're going to see what kind of results they get there. They're about 5 years into this, actually, and I think they're seeing you could go into this neighborhood. It was great. You drive down the street, and the buildings would have just this poster in it that said, "Know your A1C." That's all it said. You know, so they felt if they could get people asking questions about what an A1C was, you know, maybe they could get people focused in that direction. But interestingly enough, CDC has said that in 2025, Illinois is going to be approaching 20% of its population with diabetes. You know that nationally, it's projected by 2050, 30% of the United States could be battling diabetes. One of the most interesting slides I ever saw was a slide from 1980, which was CDC's projection for 2050, at 23 million, 25 million people they thought we'd have in 2050. We hit that in 2010. So our lifestyle, our diet, poor access to healthy foods is contributing to all of this. I mean, in Illinois, a third of our high school seniors graduated were clinically obese. I think that's considered 30 32 pounds overweight or something like that. And this is just a map. Map is old, has the counties that were approaching 10%, but we have 2 counties in Illinois now that are at 17%. They're in very far southern part of our state. We have a legislative district that has 12% of its population has diabetes. One of the counties that I represent is 11%, and it keeps growing as the demographics change. One of the communities that I represent has a high Latino population. Access to healthy foods is an issue. Access to proper diagnosis and proper care is an issue. And all these things are the things I think that stakeholders need to be talking about, because when you look at the impact that this can have to any state, I think it's huge. So in 2009, actually, we started seeing some, between 2007 and 2009, we started seeing some legislation come up. Student with Diabetes Care Act, Representative Cross had a daughter that was type 1 diabetes, and we had situations in our state where schools would take somebody with type 1 diabetes and they would not allow them to go to the school of their neighborhood, school with their friends, school with their siblings. They'd make parents take them all the way across the other side of the county to the only school that had a nurse. And so we passed a law called the Student with Diabetes Care Act that said every school has to allow a child to administer their diabetes drugs and has to be in a position to supervise it. What a great time for hospitals and diabetes educators and schools to get together and work together. But what actually happens is school nurses got together and tried to stop that piece of legislation. And it took a couple of years to pass. Actually, it took 3 years to pass, and we passed it. It's the law of the land. And guess what? We haven't had any problems. And you know, schools are dealing with actually working into their plan to have somebody that's trained to supervise that. So we got all the members together that either had diabetes, had a family member with diabetes, or had an interest in diabetes. And from this conversation we had together, I went to a dinner of the pharma group in Illinois, and I kind of threw this out. What about forming a group of people, a legislative caucus, that would bring policymakers and stakeholders together to talk about diabetes issues? And a couple of them, I don't know if Marty was there or not, were you there? I said, you know, I don't think that's ever been done. And it hadn't been done. And so we got together and we put together a group of people, started looking at what's diabetes going to mean to our state. And I think when you look at this nationally, this is phenomenal that in 2025 it's projected that Illinoisans will spend $2 billion on the care and treatment and diagnosis of diabetes. And look at California, $63 billion. Michigan, $15 billion. That's just the top 10 states. When you look at some of the southern states that are the smaller states, they actually have a higher incidence per capita of diabetes and will probably, percentage of their economy, have even a bigger impact. But I don't know how any state or any population will deal with these kind of numbers. This is exhaustive to even think about. And that alone, I think, was one of the big selling points to our General Assembly and some of the laws and getting people together and excited about, you know, maybe making some changes that made a difference in the future. So we decided that we would put together this group, and what we did is we sat down and we adopted a resolution. If any of you would like to see that resolution, we'll get it to you. There's a website called Illinois Diabetes Caucus.com, I think it is, or ILGA Caucus.com. I have it in another slide. But to work with your state, your county, and your area, we would help you do that. So then we established some bylaws about what this was going to be. We adopted some kind of a strategic plan on how we wanted to implement this and some of the things that we wanted to do, and we passed this resolution. And so what we ended up kind of deciding was that maybe this needed to have a different kind of a structure. Maybe a caucus of just legislators wouldn't work, because legislators, in fact, are a passing parade. You know, I'm retiring this year. This is my last year in the General Assembly, and somebody has to step up after me. So we created two organizations. We created the Illinois Legislative Diabetes Caucus, made up just of legislators, and the Illinois Legislative Diabetes Caucus Foundation, that's made up of stakeholders. And the job of the Illinois Legislative Diabetes Caucus, which is just the legislators, is to appoint members, 12 members to this caucus foundation. And it's made up of diabetes educators, it's made up of pharmaceutical interest, it's made up of a person with diabetes, and so we've got a well-rounded group that are passionate about diabetes. And they help us adopt goals and strategies and legislative initiatives, and it works very well. We've actually, through their efforts as a foundation, did a bowling tournament of legislators, which it was kind of fun. Marty was there, I think Ann was there, group of people. We actually had about 50 people there. You know what? We raised $25,000. We've done our third bowling tournament. We have about $50,000 in the bank now. And I'll tell you what we'd like to use that for. But anyway, the Diabetes Caucus Foundation was in a position then, because they weren't connected necessarily to the government, to raise money, manage money, and be there to help steer this as the legislators retire or don't return to the political arena. So we set this up so that the Diabetes Caucus every 2 years makes these appointments, and each of our 4 caucuses, the House Republicans, House Dems, Senate Republicans, appoint 3 people to it. Our structure, that works pretty well. We decide as a group if there's a piece of legislation that's been filed, if we want to support it or not, and from that we have done some amazing pieces of legislation. I have legislation that I filed. Imagine this. In Illinois, if you're part of our Medicaid program, we don't fund diabetes education. It's like, you know what? You have diabetes, we're going to treat it, but come back and see us, you know, if you have kidney disease. You know, come back and see us if you have circulatory problems. But we're not going to teach you how to prevent that from happening. So I actually have filed legislation to require our Medicaid program to offer diabetes education. We make our insurance companies do it. Why wouldn't we make ourselves do it, right? So it didn't get anywhere. So I came back at a different angle. And I was just telling Ann, I think this may be the year. And I said, let's make it for children that have type 1 diabetes. Let's all agree that at least a child with type 1 diabetes in their family needs intensive diabetes education. Can you imagine being the parent, a single mom, you know, on Medicaid, living with just the difficulty of even getting treatment, but not knowing how to provide the right kind of care? I can't even imagine what that must be like as a parent. And we've done some phenomenal things. I think Merck funded a grant at the University of Chicago to come up with a program for diabetes or healthcare disparities, where they've started a mentoring group in the south side of Chicago. It's working very well, and it's very exciting to see that happen. But having Medicaid not have resources for that is a problem. So guess what? You know how many children that would apply to? 2,100. The estimated cost of this is only about $250,000. Can you imagine what the payback is? I'm trying to get the figures on how many of those children end up in the emergency room, how many of those children have other complications, if we can figure that out, because certainly this is a no-brainer, and hopefully we would get that funded. So we've been able to do things like that. So our goals really are to, number one goal is to get policymakers and stakeholders to sit down and talk about this, because we think only good things can happen, and I think only good things have happened from that. Our number 2 goal is to take the issue to people's districts, legislators' districts. We did a diabetes expo in my district. I was the first district to do that. We did it with the hospital. We had 800 people show up. The hospital had like a little live remote out there. The newspaper did an editorial that said this was a phenomenal event and stuff. I mean, I couldn't have gotten that as a politician anywhere. That kind of goodwill with the community, and we've done 12 of those, and we've done in Diabetes Awareness Week. We've done about 10 to 12 diabetes awareness events each year, where we go into a factory or something like that and educate employees of a factory in a district on diabetes. And we actually take the hospital with us, and they do testing. And we've already referred something like 80 people to care. So that's been kind of interesting to see that. But if you want to see your legislator get excited, put something together in your district with them as a sponsor or a host. Each one of us have a campaign plan. Each one of us have a district outreach plan. This is the one time that you get excited if you can get people to show up at an event in your district as a district outreach plan. And we generally have some funding for that. So that works pretty well. So probably the second largest goal that we had was to have these district-centric events for our members. So this is our website, Illinois Legislative Diabetes Caucus. Actually, it's changed a little bit. Now it'll go through some of the legislation. That's kind of a much younger me in the background there, from about 10, maybe 5 years ago or so. And we've actually been able to reach out. I've been able to send links out. This is another thing a legislator has. I have 11,000 people on my email list. So when I send a link out and I talk about diabetes, it's amazing just how many people we can reach. And if there's 118 of us, and let's say we all have just 2,000 people on our email list, that's a lot of people that we're getting. And we're pretty diligent about keeping that list purged and updated. And if you write me an email, you're on my list. That's kind of how it works. So. We all have lists like that. So it's a good way to get the message out. And this is a good place for you to find our organizing resolution, our bylaws, our mission statement, our vision statement on what we want to do as a caucus. And so when we started, immediately we had 40 members. There's 179 members in the Illinois General Assembly. And of the 179 members today, we have 118 that are members of the Illinois Legislative Diabetes Caucus. We have 80 people that we've identified as affiliate members that are active either with the caucus or with the Diabetes Caucus Foundation. We've had so far 3 really good expo days where we've brought stakeholders down, and we've done many one-day seminar. We've had legislators there on things that we're doing. We've had booths at festivals promoting our caucus, and we've had 2 annual stakeholder events as well as lobby days. On the lobby days, it's a good day to go to the General Assembly and talk to your members, find your members, meet with legislators, hand out a piece on the legislation that's in process, if your state has process or legislation in process, or if you as a group, as diabetes educators, have legislation in process. Access to your legislator is very easy. It may sound like it's intimidating. It may sound like, oh, they would never want to talk to me. You show up in your capital at your legislator's office and you're from their district. If they don't see you, they don't need to be there. I mean, that's their job. And I will tell you, almost all of the legislators that I've worked with take that type of thing very seriously. And as well as they do, if you send them a letter, you'll get a response. But FaceTime with your legislator is pretty important when you're talking about diabetes issues, because I don't care what state you're from, you're faced with a big challenge with this disease in the future, and one that I bet your legislators don't know how it's going to affect the future of their state, their district, and even their politics. I mean, you can't watch a county with 17% of the population have diabetes and not be concerned about it. So all those things I think are pretty important. So in the first couple of years, we passed the Student with Diabetes Care Act. We started a diabetes checkoff on our income tax statement. And we also now have a diabetes lottery effort. And a diabetes license plate that you can apply for, and those funds all go into a fund that we are allowing to be used for various programs in state government. Student with Diabetes Care Act was probably the toughest thing to get through, and we became a resource. We had somebody contact us. I don't even know how they found out, but she worked for a large national chain that was self-insured, and she saved her money. She was type 1 diabetic. She saved her money to buy a insulin pump, and the insurance company would only cover it's called Rely-On insulin, which was Walmart's insulin, which isn't actually even, I think now I found out it's not even quite recommended for type 1 diabetes even, but certainly isn't usable in a pump, and therefore she couldn't get insulin covered. And we were able to actually work with that insurance company because under the Affordable Care Act, the states don't have control over self-insured funds, but we were able to work with them, and by the time we were done, they covered it. And made it a policy that they would cover insulin for pumps anytime somebody had one. So we think that's pretty important, and so we were able to make a impact on that. But we have 25 pieces of legislation that we've worked on, and about 17 of those have passed. And one of the things that I will tell you that I've become committed on in the last 3 years is access to food. When we go to Humboldt Park, the highest incidence of diabetes in a big city like Chicago doesn't have a full-service grocery store in that neighborhood, and that's a problem. But if we go to any town in small-town Illinois, or we go to, probably in your state or wherever you're from, it's the same. When I was a kid growing up, you could go to that town and you'd see a meat market on Main Street, and it'd have meats and fresh fruits and vegetables in it. That's gone now, and it's been replaced with the gas station convenience store model, and they have beef jerky and lunch meat and chips and milk and hot dogs. And if you're 80 years old and you don't have a car and you're in a small town in rural Illinois, that may be where you have to get your food. So we realized that getting access to fresh fruits and vegetables is an issue, and that one of the things Illinois didn't see a lot of anymore were farmers markets, and we've been very active in changing our laws so that our local health departments don't have so many regulations that either makes local farmers markets unprofitable or are so restrictive they can't do it, because we had 100 health departments, 100 different ways they regulated farmers markets. So we've been able to take a statewide approach that came out of the Diabetes Caucus. And I can tell you, it's kind of one of these things. I saw once a bumper sticker a couple years ago that said, if the people lead, the leaders will follow. When I go into restaurants now in my district, you know what? They want to put the farm they got the food from on there. They want to say, these are the fresh vegetables that we have. We actually have 2 restaurants in my town of 25,000 that have plots of land they grow their own vegetables on. And it's because people are demanding that kind of thing. So we are seeing an impact and a change in the way people are starting to think about access to, sustainable foods, local foods, that kind of thing. And it's important, I think, that legislators hear that too. But now we passed a bill that we have about 100 of our farmers markets. We have 2,000 communities, roughly 2,000 communities in Illinois. We only have 500 farmers markets. Out of that 500, we have around 100 that take a link card. Well, USDA, United States Department of Agriculture, one of their divisions, has $100 million in a fund to provide incentives for people to use the SNAP program at farmers markets. And so we have a bill now going through the General Assembly to appropriate $1 million for that. And I'm told by the farmers markets $1 million appropriation, which would yield $2 million in funding to go to farmers markets to provide double bucks for people on Medicaid or on using Link Card and on the SNAP program to be able to get healthy fruits and vegetables is a huge commitment, and we'll probably see that go. Missouri is doing that. Our plan is to do this on the first $10. So if you come to the farmer's market, you have a link card, you will be able to get your first $10. You'll be able to get $20 worth of vegetables or fruits, and they're doing that in Missouri. They're doing that in probably about 6 or 8 states right now, and in some states they're doing it with donations and so forth. But this is a program I think that needs to grow because access to these foods I think is one of our problems. So we've kind of gone over this. Our goals haven't really changed. We see legislation, good and bad. We saw legislation pop up. We were able to kill what somebody thought was a very good diabetes legislation, which was legislation somebody put up that said you couldn't drive a school bus if you had type 1 diabetes. And there was a physician in rural Illinois that thought this was an important thing. And I can tell you that we engaged the American Diabetes Association lawyers. They were phenomenal. And come to find out, if we'd have passed that law, it would have violated a whole host of other problems, and we were able to stop that. We've had people that have wanted to change the way diabetes test meters and any durable equipment and pumps get paid for. That probably wasn't the best piece of legislation, so we were able to work to kind of make it a better piece or to stop it. But we really got active in 2011, and the caucus has passed 15 pieces of legislation. I think that's a very good accomplishment. So what I would say is that policymakers have a key that unlocks a tremendous opportunity for the entire industry that services diabetes, services a constituency group, and services the entire population of your state. And that key is legislation. That key is putting it in the political forum to where it can make laws, change laws, and make a difference. And to leave this aspect untouched as advocates for diabetes treatment and diagnosis and control is a mistake, because so much good can happen by enacting your legislators. We have states that still don't require insurance companies to fund even test strips. We have states that don't require insurance companies to fund a lot of the diabetes needs that a person would need. And they find out too late that the insurance they do have doesn't cover the stuff that they need. And those states, I think, need to have some advocacy for that. And I can tell you a good thing that's happened from this is there are 12 states that have now diabetes caucuses. I've gotten to fly to several states to speak to their general assemblies about this. And the Diabetes Action Plan was actually something that was birthed at the Council of State Governments in California at a dinner of legislators and people from the pharmaceutical industry and diabetes educators, where we discussed some things that some states were doing and some states that already had diabetes action plans, and we thought it'd be a good thing if we could get every state to pass a resolution to have a diabetes action plan that actually had the same data in it. One of the problems that CDC will tell you they have is getting the data from the states the same way, And so we went on a mission for states to do this. And I don't know how many states have passed legislation. Not every state has, but certainly the ones that have, the 12 that have diabetes caucuses have been working on that. That would be a great starting point for any association in your state to work on, is to try to work with your Department of Public Health or whatever agency actually has control of the diabetes dollars that come in, and there's not a lot of dollars that come in, but they're administered. And part of that requirement from CDC is to have some type of reporting mechanism. But if we could get all the states to have a diabetes action plan with some of the same reporting requirements, that would be a great place to start with your legislators. One of the things that I fear is some of the federal funding for diabetes isn't coming in anymore as federal funding for diabetes. It's coming in as healthy lifestyle incentives, things like that. And I'm worried that the actual focus on diabetes is going to get caught up and merged with the focus of healthy lifestyle, which are, I mean, healthy lifestyle helps in preventing diabetes, and it certainly helps with the treatment of diabetes, but that concept to me doesn't get people focused on diabetes. And even though we have all these things, we're still seeing the disease grow rapidly. And so that is a concern to me in the future. And I can't probably express enough about getting a group of people to have a lobby day in Springfield. We have groups of people coming, are in your state capitol. We have groups of people coming for things, everything you can imagine. You know, we have association of dry cleaners coming down to lobby us about dry cleaning solvents. We have, you know, it's just any issue you can imagine. People come in groups or they have representation there. Don't leave that uncovered. Has anybody lobbied their legislators? Have you? So everybody's familiar with this, right? Well, getting them organized and getting them together and getting them focused, diabetes action plan, some of the things that you can do, finding out if Medicaid in your state covers diabetes educators. I think that's tremendous. Another thing in our state, gestational diabetes. If you're 50% of the births in Illinois, believe it or not, are paid for by the state of Illinois as through our Medicaid program. 50%. The women who are suffering from gestational diabetes, once they have the baby, they're done. There's no follow-up. There's no access to any kind of care except whatever they're able to do on their own. That's wrong. That is wrong, and it needs to be fixed. And it's not a federal requirement that we do that. And hopefully, through some federal initiative, we can start making a difference. But every state should be talking about that. We have a bill now. We're trying to push through on that and go from there. So I can tell you that. Making a difference in diabetes is what I like to do. It keeps me focused, and there's so much to do. And if we work together, maybe we can make a difference in some of these numbers that we've just saw. So with that, I would first like to thank you again for having me here. But I'd certainly like to answer any questions that you may have. So.
Well, thank you, Mike, for all your tireless work on diabetes. Ann Daly introduced me to you, so you know I'm president of AADE this year. So I have a question to dig into the details a little bit, and that is, you used the word foundation. So is that set up as a 501c3?
Yes, it is. Yes.
So can you sort of explain that a little bit?
Okay.
And did that allowed you to take some dollars?
Mm-hmm. So that's a great question. When we sent our application in for a 501(c), which is a nonprofit section of the IRS code, we were told that it was probably going to take a long time. We had it in 60 days. Okay. We talked to our congressman about it and our U.S. senator about it. I mean, see, this is where you have some access to maybe getting things done. And they didn't seem to think it would take very long, and we got it through in literally 60 days. We became a 501c3. We had to put together an estimated budget. I was very aggressive on that, put together a budget for $500,000 a year. We're nowhere near there. Our goal, by the way, our big goal, is to raise enough money through grants and foundations to actually have a couple of interns that are working on their master's in public health in the health education part, which we have that program at University of Illinois in Springfield. So we put that out, and that's our goal. We're actually in the process of funding a grant writer to apply for grants. There's a grant at CDC I think we're going to apply for, but some of the pharmaceutical foundations, there's several foundations that we've identified where we might be able to apply for grants. And then the people that we hire would keep that going. But in order to do those kind of things, you have to do that under some type of corporation, and the 501c3 laws work very well for that. But somebody has to make sure the tax returns get filed, and there is a lot of work involved in maintaining that. And so that's all done with this foundation. And they've been very good, and they're just as excited about this as I am. So that was a great question.
Can you talk about the importance of doing in-district visits with legislators and the impact that that has?
Okay, so when you go to your legislator's district office, that you'll have the opportunity to spend a lot more time than you're going to have at your Capitol. But if you, and you know, they'll spend, I'd say, half hour to an hour with you talking about going through whatever you want to go through. But if you can connect that legislator to the issue in your district through some event, whether it's the Kidney Foundation's Kidney Mobile that comes, and they're part of the host of that, and you ask them, you know, we know you probably have an email list, and you know, if you'd like to email this out, we would like to, you know, have you as one of our hosts, and that's the kind of thing that I think gets a legislator very excited, not about necessarily the event, but about the outreach and the constituent contact. We have a lot of our legislators that have women's health days, and we have legislators that have programs with schools and stuff like that that regard health. But diabetes, you know, if 10% of one of my counties has diabetes, I mean, when we had this expo, we had drug companies there, we had Seattle Suttons there, we had people, companies with meters there. There was a lot of stuff that was given away, and we've never not had probably, I'd say the minimum number that we've had at those things, in any one of them has been 500 to 600 people that have come through. Representative Cross had 1,200 come through. So his expo day that he did with his hospital. But that was an in-district event. You do something like that, you have your legislator on your side forever, you know, and that's I think a great model. So.
Hi, thanks, thanks so much for joining us, and thanks for all you're doing for people with diabetes. I'm really interested in the diabetes caucus you have here in Illinois. From what I understood, it's three members per Dems reps on House and Senate, so it's 12.
Okay, so it's the structure of there's two organizations, the Illinois Legislative Diabetes Caucus, which is just legislators. That's made up of 12 legislators. And then there's the Illinois Legislative Diabetes Caucus Foundation, and that's made up of 12 stakeholders. And the legislators make appointments by each caucus to the foundation. And then, right.
So so it's a limited number. It's not like anybody can say, hey, I want in.
Right.
What I'm trying to contrast it is with the caucus in Congress. We were having a conversation yesterday about how it's a huge caucus and you know, very ineffective.
The one in Washington?
Yes.
Yeah, 250 members, right?
Yeah, and then you have people there who haven't even sponsored a single diabetes bill. So can you speak to how the caucus operates and what kind of requirements? I mean, if you're going to be there, what is this expected of you as a
Okay, so what we've done is this expo that we have, where we bring the stakeholders in, and we have like a half-a-day seminar on what's going on in the industry and so forth, and the lobby day where we have the industry. We've had, I don't know, busload of people come from the Chicago area that are diabetes educators, and you know, people coming by car from the rest of the state, where we've had probably, I don't know, 70 people, 80 people come for lobby day. And we'll have a lunch and stuff like that. That gets them there. But the in-district thing, you know, in D.C., if you could get the congressman to have something for diabetes, and, you know, in our state, I don't know who that congressman is at the very bottom, but I'm going to guess it might be Rodney Davis or somebody like that. You know, you get them to do a diabetes thing with maybe with one of their local legislators, and have the two of them host a diabetes awareness event. Start getting them involved. Legislation will come. you know, I know how difficult it is to pass a piece of legislation. I can't imagine how difficult it is to do that in D.C., where you've got, you know, 3 times the number of people that we have, 4 times the number of people that we have. But it can be done, and I think it's about getting them involved in the issue in their district. I think that's what's missing with that. And I've met with them. I've flown to D.C. and met with the director, who's one of the congressman's aides. And we've talked about stuff like that. And, you know, maybe that's something I can do when I retire, go out and help work on that. So I would love to do that.
Well, again, I want to say thank you so much for being here. This is really informative. And I'm the state AAD grassroots coordinator from the state of North Carolina. And when you mentioned self-funded companies, it made me think of something I'm seeing in North Carolina, but also because part of the work I do is in telehealth and talking to people across the country. I'm seeing more and more companies, self-funded, move to these high-cost deductibles, which are wonderful for perfectly healthy people. But for anyone who has any sort of chronic illness, particularly, you know, if they're single or have a family, you know, you're looking at a deductible of anywhere from $2,000 to $5,000. So for people who need their, you know, I think this is going to be the next big wave of people who can't afford their diabetes medicines. I mean, we're already seeing it in the work that I do. And usually we'll tell them things like, you know, talk to your doctor, try to get them to intervene with the insurance company, go complain to your HR department, you know, about this horrible insurance plan they put you on. But how can we advocate? What else can we be doing? Because I think that's a whole nother group down the pike coming.
Absolutely. I mean, there's a lot of good things that came from the Affordable Care Act, and I'm a Republican, so I have to, you know, access to health care is important, and that's really what we have an issue with. And I would suggest that one of the bad things about the Affordable Care Act that did happen is it made it I mean, states can no longer regulate large self-insured plans because otherwise we would be engaging in that. And I will tell you, someday the federal government will have to deal with that. I mean, you can't have health care reform and then have a large segment of this population not be able to get health care because they can't afford the deductible. I mean, that did nothing. You know, in fact, in that scenario, that one scenario, you didn't fix the part that was broken, you broke the part that was working, which was employer-based health care that was regulated by the states, okay? So, I mean, I think we're in a stopping off place where it comes with the Affordable Care Act, and I think people are going to get focused on it. There's still people that can't afford it, and people can't access it, and small employers. I have 25 employees in my business. It's getting so I can't afford it. You know, I mean, and so I think I don't think this is far from over, but I can tell you that large populations not being able to access things like diabetes drugs is going to be an issue, and it's going to land on somebody in Washington to have to fix it. That's just unbelievable. My own frustration, imagine every time the state decides they're going to change providers for a drug card, I had to take a new diabetes drug. You know, I used to take Victoza, then they stopped carrying Victoza. Now I take Trulicity, you know, I mean, so it's just, you know, it's a constant battle you're going with. That's why I tell people all the time, don't look at this as a disease. You'll be really frustrated. Look at it as a hobby, because it takes every bit as much time as a hobby, you know, and that's how I try to deal with it. You know, got up this morning, tested my blood sugar. You know, I mean, you just have to do that, you know, and that's in my own mind how I deal with it. But I think it's important that you carry that message wherever you go. It's a message, you know, we're hearing, and if we're hearing it and we start arguing with our congressmen about it, I think somewhere along the line that's going to change. And the sad thing is, those large plans are from large companies that are generally very profitable, you know, and it just doesn't seem right that you're going to dictate to somebody like me who has 25 employees, this is what I have to have, you know. I mean, it's just that's not right. So. All right, well, thank you for having me, and I hope it was interesting, and I will make you this promise. If any of you, wherever you go in your states, want to have a conversation about things and the way we've done things, want copies of our pieces of legislation, anything, I'll be there for you, and I'll help you work on that. So thank you.